1. What do you think is the essence of an ABA therapist's work? Answer. An applied behavior analysis therapist assists clients in social skills development, language acquisition, self-help strategies and development of daily living skills by applying various behavioral therapeutic interventions. ABA therapists assist patients in changing their behavior with a view to make them more productive, socially active and healthy-minded. Question 2. Do you consider autism retardation? Answer. Definitely not. Some children with autism have a higher IQ than even the most intelligent of people. Question 3. Imagine that you are working with an autistic child. What measures would you take to assist him or her to indulge in extrovert activities? Answer. It is difficult to provide a standard answer here, as each child with autism has different learning abilities and limitations, so each child has to be treated according to these. The first thing I do in a situation such as this is to entice the child's imagination so that he or she can determine the fun associated with an extrovert activity. The rest depends on how they react. I just take their cue. Question 4. What kind of patient-therapist relationship do you avoid when treating patients? Answer. It is very difficult not to get emotionally involved with a patient. For most part of the day, a patient is in my care and it is up to me to provide him or her with everything that he or she needs, both physically and emotionally. While it is difficult, I try not to get emotionally involved and still maintain compassion and understanding so that I can treat them effectively. Question 5. Name some therapeutic techniques that you like to use most. Answer. I usually decide the techniques after evaluating the case. However, the ones I use most commonly and have found to be very effective include pivotal response training, positive reinforcement systems, and incidental teaching. Question 6. What is the basic information you collect while compiling initial case history? Answer. The initial case history data form includes information like the name, age, gender of the patient, his or her medical history, marital and socio-economic status, birth order, observable physical and behavioral problems and the like. Question 7. Share a time when you had to face an obstacle. How did you handle it? Answer. I was treating an autistic child using combination technique that utilized pivotal response and incidental teaching methods, and the child was responding positively to the treatment. All of a sudden his condition got worse and I was disappointed. I changed the strategy but still could not attain the desired result. On further investigation, I found out that the child was being bullied at the school by a new class fellow. I coordinated with the teacher and the issue was finally resolved. Question 8. Tell me about an experience where you had to convince parents regarding treatment of their child/children. Answer. I had the case of a chronically depressed boy aged 11 who was from a broken home and was under care of foster parents. I developed an individualized treatment plan for him, which among other techniques included some positive reinforcement methods. The parents were reluctant to practice those at home. I had 2 detailed sessions with them to explain the treatment and its benefits with special reference to that child's case and eventually convinced them. Question 9. What measures do you take to ensure effective coordination in your team in order to achieve set targets? Answer. Whenever I am assigned a team task, I schedule a daily brief plenary meeting with all team members and a weekly progress development analysis meeting. This enables ample communication and exchange of information regarding the case or cases, and the future treatment plans are also chalked out in these sessions collaboratively. Question 10. What kind of people do you get along with best and why? Answer. I am a straightforward person and work best with people who word out their expectations of me. However, I do have an adaptive personality and usually enjoy positive relationships with my employers, colleagues and clients. Question 11. What do you enjoy most about being a therapist? Answer. I enjoy every phase of the therapeutic process. I thrive on the challenge of diagnosing the case, devising and implementing the most appropriate treatment plan, and above all, I enjoy watching the plan work. Question 12. What is an applied behavior analyst? Answer. An applied behavior analyst is someone who has in-depth knowledge of the field and methods of the study of the science of behavior. Behavior analysis services help people learn new behaviors, increase or reduce existing behaviors, and teach individuals when to use specific behaviors in specific instances. The scope of these services ranges from addressing challenging behaviors of an individual person to changing the behavior of an entire organization or community. industry. Behavior analysts provide services to individuals, families, group homes, schools, mental health agencies, hospitals, industrial and business settings, and other agencies working with individuals who require intensive behavioral training and/or consultation. Training and consultation are performed in the areas of educational and adaptive living strategies, challenging behaviors, and staff management. Special populations such as individuals with autism and other developmental disabilities have been shown to benefit greatly from ABA services. ABA is also frequently used in the field of education, from typical students to students with disabilities. Behavior analysis professionals are strongly recommended to pursue BCBA certification by the Behavior Analysis Certification Board. This is the industry standard and is nationally and internationally recognized. Question 13. What is a board-certified behavior analyst? BCBA. Answer. The board-certified behavior analyst is an independent practitioner who also may work as an employee or independent contractor for an organization. The BCBA conducts descriptive and systematic, for example, analog, behavioral assessments, including functional analysis, and provides behavior analytic interpretations of the results. The BCBA designs and supervises behavior analytic interventions. The BCBA is able to effectively develop and implement appropriate assessment and intervention methods for use in unfamiliar situations and for a range of cases. The BCBA seeks the consultation of more experienced practitioners when necessary. The BCBA teaches others to carry out ethical and effective behavior analytic interventions based on published research and designs and delivers instruction in behavior analysis. BCBA supervise the work of board-certified assistant behavior analysts and others who implement behavior analytic interventions. The Behavior Analysis Certification Board (BACB) awards this credential to individuals who have met coursework, degree, fieldwork and examination requirements. To become eligible for BCBA certification by the BACB, applicants must meet one of the following three options. Option 1 requires an acceptable graduate degree from an accredited university, completion of acceptable graduate coursework in behavior analysis, and a defined period of supervised practical experience to apply for the BCBA examination. Option 2 requires an acceptable graduate degree, a full-time faculty position in behavior analysis that includes research and teaching, and supervised practical experience to apply for the BCBA examination. Option 3 requires an acceptable doctoral degree that was conferred at least 10 years ago and at least 10 years postdoctoral practical experience to apply for the BCBA examination. Question 14. What is a board-certified assistant behavior analyst? BCABA. Answer. The BCABA conducts descriptive behavioral assessments and is able to interpret the results and design ethical and effective behavior analytic interventions for clients. The BCABA designs and oversees interventions in familiar cases, for example, similar to those encountered during their training, that are consistent with the dimensions of applied behavior analysis. The BCABA obtains technical direction from BCBA for unfamiliar situations. The BCABA is able to teach others to carry out interventions once the BCABA has demonstrated competency with the procedures involved under the direct supervision of BCBA. The BCABA may assist a BCBA with the design and delivery of introductory level instruction in behavior analysis. It is mandatory that each BCABA practice under the supervision of a BCBA governmental entity. Third-party insurance plans and others utilizing BCABAs must require this supervision. The Behavior Analysis Certification Board (BACB) awards this credential to individuals who have met coursework, degree, fieldwork and examination requirements. The Behavior Analysis Certification Board (BACB) awards this credential to individuals who have met coursework, degree, fieldwork and examination requirements. Requirements for the BCABA certification include: degree. BCABA certification requires a minimum of a bachelor's degree from an accredited university, completion of approved coursework, and a defined period of supervised practical experience to apply for the BCABA examination. Applicants must meet all eligibility requirements, apply for the credential, and pass the BCABA examination to become certified at the BCABA level. Coursework must come from a qualifying accredited institution and cover the required content outlined in the B.A.C.B's 4th edition task list and course content allocation documents. Only courses where the applicant was formally enrolled and earned a passing grade, C or better for graded courses, are acceptable. Experience. Applicants must complete experience that fully complies with all of the current experience standards. Applicants should carefully review the experience standards with their supervisors before beginning their experience. Applicants must complete experience that fully complies with all of the current experience standards. Applicants should carefully review the experience standards with their supervisors before beginning their experience with their